Hello everyone, welcome to my channel.
The Life of Biochemistry by Harish. In this video, we will talk about Zika virus disease and let's be more detail about what is Zika virus, how is transmitted to one person to other person, what are the symptoms, how can diagnosis and how is treated. First of all, we are see about introduction of Zika virus. Zika virus is a single stranded RNA virus with the genome of 10,794 kb length. Zika virus is a mosquito-borne flavivirus that was first identified in Uganda in 1947 in monkeys. It was later identified in humans in 1952 in Uganda. This, what is Zika virus disease? Zika virus disease is caused by a Zika virus that spread through mosquito bites. The Zika virus is spread mostly by the bite of infected Aedes species of mosquito like Aegypti and Aedes albictus. The majority of people infected with Zika virus do not develop any symptoms. At the same time, 1 out of 5 people developed some symptoms. It's similar to dengue virus. It's also spreaded by the same as a vector and it's a very rare disease. We are see about history of Zika virus. In 1947, the first Zika virus was identified in Zika forest of Uganda. It's called Zika virus. In 1952, first human cases of Zika virus in Africa, Southeast Asia and Pacific. Before 2007, 14 cases of Zika virus has been documented.
In this current situation, this virus is increased in Kerala from India. There about 13 people are suffered from this virus within a few days.
We are see about immune power against the Zika virus. Once a person is infected with Zika virus, he or she like to be protect the lifelong against the Zika virus because due to the memory cell area long-lived immune cell, it's capable of recognizing foreign particles they were particularly exposed. These immune cells do not respond immediately when it first encountered antigen, but it facilitates a more rapid secondary response when the antigen is encountered of subsequent occasions.
Next we are see about how this Zika virus are spreaded. I already told you that the Zika virus are spreaded through mosquito bites and also is transmitted to pregnant women to her fetus through the sex. And sometimes the Zika virus are spreaded through blood transfusion. It's a very like but not confirmed. And then there is no reports of infants getting the Zika virus through the breastfeeding.
What are the symptoms of Zika virus? In many people infected with Zika virus, there is no symptoms. At the same time, some people like will only have mild symptoms. That's like fever, rashes, headaches, joint pains, redness of eye, and muscle pains. Next, we are see about how can Zika virus affected the pregnancies. Yes, I already told that Zika virus can passes from pregnant woman to her fetus during the pregnancy. Yes, once Zika virus infection is occurs in pregnancies can causes a birth defect of the brain is called microcephaly and also occurs some problems such as miscarriage and stillbirth. That means loss or fetus isn't developed and also occurs in Guillain-Barre syndrome in some peoples. If does Zika virus causes the Guillain-Barre syndrome? Yes, the Zika virus causes the Guillain-Barre syndrome. The GBS indicate the Guillain-Barre syndrome. GBS is an uncommon sickness of nervous system in which person own immune system damage. Mind this word. In this person, own immune system damage the nerve cells, causing muscle weakness and sometimes paralysis. How does Zika virus causes the microcephaly? The Zika virus attacks the brain stem cells, so cannot grow the brain cells. It leads to the microcephaly problems are occurs, and some problems are linked like seizures, developed delayed such as speech, sitting, standing, and walking, intellectual disability, and third one is a vision and hearing problems, and fourth one is a feeding problems, and fifth one is a problem with movement and balance. The second picture is shown microcephaly, the small head size. How is Zika virus are diagnosed in our body? The diagnosis is based on the person's recent traveling history, symptoms, and test result. The blood and urine test can be detect the Zika virus infection in our body. We are see about incubation period of Zika virus. To estimately 3 to 14 days are incubation period for Zika virus. Next one is how is Zika virus are treated. There is no specific medicine or vaccine for Zika virus. At the same time, self-care are there. That's like get plenty of rest. Next one is a drink fluid to prevent the dehydration, and do not take the aspirin or other non-steroidal anti-inflammatory drugs. To take Tylenol to reduce the fever and pain. What to do if you have Zika virus? Yes, I already told you that the Zika virus can be found on blood, and this virus can be passed from an infected person to other person through the mosquito bites. So once if you have Zika virus is detected, immediately protect yourself from the mosquito bites during the first week of illness due to the cannot spread it to other person from you. Next we are see about prevention. First one is a protect from mosquito bites. First, wear long shirt and long pants and control mosquitoes outside in your home and control mosquitoes inside in your home and use a insect repellents and protect your family, especially babies.
This picture is represent as the best way to prevent the mosquito bites in our home.
Next one is a prevention of sexual transmission. About sexual transmission, protect your life partner. Condoms can reduce the chance of getting this Zika from sex.
Thanks for listening. Please subscribe my channel and press the bell button and you will get the all notification from my upload.